Tipping over or falling out of a wheelchair is not common, but it can be dangerous and cause serious injury. Tips and falls are among the greatest fears for many wheelchair users. Understanding why a tip or fall might occur and taking precautions are the best way to address this fear and allow you to learn many valuable wheelchair skills, even ones you might not think are achievable. Tipping or falling forward is perhaps the most likely risk for injury. When the wheelchair is stationary, several situations can create a tipping risk. Stepping or standing on the footrests when getting in or out of the wheelchair can cause it to tip forwards. Reaching or leaning forwards, or even sideways, can shift too much weight toward the front and create a tip or cause you to fall out of the wheelchair. Never stand on the footrests, and do not step on them without having your bum on the wheelchair seat. Ensure the wheel locks are engaged, your bum is far back on the seat, and secure yourself when reaching forwards or sideways. Forward tips and falls can also occur when the wheelchair is in motion and comes to a sudden stop. If you are propelling the wheelchair and encounter even a small obstacle that stops the small wheels in front, your momentum can cause the wheelchair to lurch forwards, and you may slide off the seat or topple out in front of the chair. Controlling your speed and shifting your weight backwards, especially when coming down an incline, can greatly reduce your risk of a forward tip or fall. If you are practicing a skill that has some risk for forward tipping, your spotter can keep one hand positioned in front of you to prevent a forward fall if necessary, but should not be so close that they get in your way. The design and setup of your wheelchair can make it more or less tippy. The further back your drive wheels are, the less tippy the chair is. This is a compromise because a tippier wheelchair is also easier to push and navigate around obstacles. Your therapist or wheelchair prescriber can help you select and set up the chair so it is best for you. Tipping backwards can occur if you are leaning backwards while going up an incline, if you propel too quickly from a standing start, or if you don't have sufficient control when you need to briefly pop your front wheels. Most wheelchairs have anti-tippers that will prevent most, but not all, backward tips. In the unlikely event that your wheelchair is tipping backwards, a good strategy is to lean, tuck, and pull. Lean forward, tuck in your chin, and pull the drive wheels towards you. This will either prevent the fall or minimize injury if the wheelchair does tip over. When spotting during activities with a risk for backward tipping, always use the spotter's strap. The spotter's strap can be successful in preventing most rear tips. If the wheelchair is beginning to tip backwards, the spotter can lean forwards, pull up on the strap, and stop any further tipping. If necessary, the spotter can also use their leg to help prevent the wheelchair from tipping. The spotter can continue to pull up on the strap and pull on one of the handles to return the wheelchair to an upright position. If this is not possible, gently lower the wheelchair backwards and seek assistance to return the wheelchair and the user to an upright position. A sideways tip or fall usually occurs when either the left and right wheels drop off a surface. This may happen if one wheel dips down into a pothole, causing the chair to tilt. It may also occur if the left and right wheels move on or off a surface at different times, like coming down off a curb. This is even more likely to occur when coming down a slope like a ramp and the front wheels drop off a ledge at different times. Sideways tips and falls are best prevented by approaching obstacles or ledges evenly, so your wheels touch at the same time. Sideways falls may occur when the wheelchair is stationary and you are reaching forwards or sideways. Again, always engage the wheel locks so the chair doesn't move, sit far back in the seat, and secure yourself while reaching. Turning your casters forwards or towards the side when you are reaching can also increase the stability of the wheelchair.